Hello and welcome. It is now day 10 of the All India lockdown. Our country now has 2,301 positive cases of coronavirus, out of which 336 new cases have been reported in the last 24 hours alone. 56 deaths have occurred in India due to COVID-19, but 157 people have recovered. That's the big news point. There's been the third positive case reported from Dharavi. Dharavi, of course, that's the distinction of being Asia's biggest slum. Now, we know that these numbers can be worrying. The updates are coming in fast and furiously, and we know that you, our viewer, may have a lot of questions and clarifications. And so this is the show where we allow you to put these questions across to the best in the business. And tonight, that's Dr. Suranjit Chatterjee. He's the head of internal medicine at the Apollo Hospital, and Dr. Arvind Kumar, chest surgeon at the Gangaram Hospital and founder trustee of the Lung Care Foundation. Both of them joining us on the show. So, but first and foremost, doctor, before we go across to our callers who are calling in, I have a question myself. You know, for several weeks, healthcare professionals, even the WHO, have been telling the public that everybody doesn't need to use masks, protective face masks, only if you're sick or if you're caring for someone who has COVID-19. But now we seem to be seeing the health officials coming around to a different point of view, where we're asking even the general public to wear masks. So what is where do you stand on this? And please help the public understand this better. Why is there this change?
So up till now, the stand had been that N95 mask is only for the healthcare professionals who are looking after these patients in the ICU, especially those who are directly in contact with the patient, intubating the patient, etc. So that was the time. So those who are immediately around a positive case, looking after that case, are supposed to have N95. The rest of the people in the hospital were supposed to have a triple layer surgical mask. This triple layer surgical mask was also recommended if you are suspected and you are having coughing and all, to prevent others, as also for those who were looking after a suspected patient or somebody in quarantine, because this was supposed to be preventing the direct transmission. So up till now, routine use of mask for public at large had not been recommended for several reasons, one of which was that it does not protect the virus from going inside. When a suspected person is wearing is, when he coughs, this mask actually effectively prevents the cough droplets from going away. But otherwise, when you are wearing it for protection, the virus can still go inside, the droplets can go. And hence, second thing, oftentimes when you use this mask for some time, especially when you put the cord which takes it, which goes around the ear, there is some amount of itching on the face and you need to readjust the mask. So you actually end up touching your face many more times, thereby increasing your chances, and therefore it becomes counterproductive, and hence up till now it had not been recommended. Now, if there are large number of people around you, and so even today, I would say the most important thing which will prevent you from getting it is to keep that 1 to 1.5 meter distance. When people who are coughing, if they are wearing a proper mask, so the droplets will not come out and go long distance. And if you are maintaining 1 meter to 1.5 meter distance from these people, there is no way that you will inhale those droplets. Equally important is the hand hygiene, which needs to be practiced rigorously. It becomes very cumbersome how many times you will wash your hand. But then as long as this menace is around, we have no choice but to continue to do it. So maintaining a distance and hand hygiene is even today the two most beneficial methods of preventing this infection.
Okay, so let's also get Dr. Suranjit Chatterjee in here. Doctor, do you agree? Because now, like I said, the WHO and the New York mayor has now advised everybody in New York to actually wear a mask. This was different from in the past. Given that we are now reading and hearing more that people who are infected don't show symptoms, which means they are infected without really being aware of it. Where do you stand on this new understanding that everybody should actually be wearing masks?
No, I would totally again agree that wearing a mask routinely, I'm still not recommending it, that everybody should wear a mask. Yes, when anybody who is suspected or who is having the symptom of cough, cold should be wearing a mask so that he or she can protect others from getting infected from that person. And when anybody who's maybe visiting a healthcare center or who is visiting a very crowded place, maybe he can wear it, because as it was mentioned earlier also, that handling a mask is very difficult. And once you handle that mask improperly, actually your risk of getting infected is much higher than otherwise not getting infected. So I would also definitely not recommend a routine wear of mask, because handling the mask is also very difficult.
All right. Thanks, doctors. But I'm getting lots of callers. So I'm going to go across first to Wahab from Mumbai. Go ahead, Wahab.
Good evening to you. Thank you very much for the response you are giving me. I thank all the noble doctors and medical people that they are doing a noble job for which God will reward them the best. Now let's come to the question. Now the coronavirus, what is the life of coronavirus? If the coronavirus, somebody is positive, then in that case, how much is the life of the coronavirus? And if somebody is affected, so a second question, please. If somebody is affected and he or she isolates oneself without any treatment, can he be treated by taking all due hygienic and distancing care? Third and the last, if you do not mind.
All right, Wahab.
Third and the last, if you do not mind, I wish that all channels of the TV, YouTube, WhatsApp, whatever it is, should fix a time for 5 or 10 minutes, equal time to everybody, thrice in a day, with the expert doctors to advise them how to take care and get rid of the corona.
All right, thanks, Wahab. That's
people.
exactly what we're trying to do here. So let me quickly let the doctors go ahead and ask those questions, because we have other callers too. So maybe Dr. Kumar, would you like to start with the first?
Yeah, so his question was that if somebody is having symptoms, what precautions she should take? Sorry,
I think the question was how long does the virus live in your body?
So when the virus enters your body, there is something called incubation period, during which period you do not have symptoms, but the virus is multiplying in your body and you are infectious. Now that incubation period may vary from 2 to 10 days. Average, it is supposed to be 4 to 5 days, after which you get clinical symptoms, which consist of fever, severe cough and sore throat, which lasts about 10 days or so. So typically the whole cycle is about 2 weeks or maybe few more days, up to maybe about 15 to 20 days. Since it's a respiratory virus, it is supposed to be get cleared from in this period. So typically 2 weeks, but we can give 4 or 5 days more, say maximum in 15 to 20 days time, it should get cleared. So respiratory wise, you will become okay. But there are now many reports coming of this virus continuing to be found in the feces of those who have otherwise become negative as far as the nasal or throat swab is concerned. So we need to keep precautions, and especially this stool part is something which needs to be carefully looked after.
All right, so updates on this story never end, they keep coming in. Ashok Sharma from Bengal, what's your question for Dr. Chatterjee?
Ma'am, I am from Bangalore, and the very famous doctors are on your channel now. I think if I will speak in Hindi, and other people, those who don't understand English, they will also get the guidelines from these doctors.
Go ahead, sir, with your question.
Now, my question is, I am reading on the social media that the people who are suffering from coronavirus in Wuhan, they are being treated with only steam, hot water, and hot milk, and they are getting cured. Is this true? One. Secondly,
all right, let's go across to Dr. Chatterjee. Go ahead, Dr. Chatterjee.
See, as we have been already mentioning, that most of the patients actually don't require, they just require a symptomatic treatment. Whether you're taking a warm water or some warm milk, whether it's helping or not, it might be just soothing. It might be just soothing your symptoms. Most of the people actually don't require any active treatment. They just require a symptomatic management of like maybe cough or fever if they're having. And what is more important is just isolating yourself, which is more important. So these are only conjectures that, okay, the hot milk is helping or warm water is helping. I think they are just soothing your symptoms, and most of the people will actually get treated on their own. The only thing that they have to do is they have to isolate and quarantine themselves so that they don't spread the infection to others.
That's most crucial. We have Dhruva joining us from Mumbai. Dhruva, go ahead with your question.
Okay, ma'am. Okay, doctors. So my question is that basically the water which we obtain, which comes from the municipality, be it potable water or the boring water, can we consider it to be safe? I mean, is there any possibility that the virus could spread through that?
So
Dr. Kumar?
There is no report till now of this being a waterborne. It's an airborne, it's a respiratory virus. So this orophycal route is not yet reported as one of the methods of transmission. At present, it is only droplets direct person to person or transmitted via hands. These are the two methods. And if I may just add to what Dr. Chatterjee said, there are a lot of videos circulating regarding drinking hot water, drinking alcohol also are there, putting drops in the nose, putting alcohol on your body, taking bath with the hot water, etc., etc. Well, none of them will prevent you from getting the virus. Two things which will prevent you. One is social distancing, taking care to keep at least 1 meter plus distance, and other is frequent hand hygiene. Otherwise, as Dr. Chatterjee said, 85% of the patients only need symptomatic care. Whether you do anything or not, they become all right. Only 15% need specialized treatment in a hospital.
Okay, Karan Singh has a question from Rukela. Go ahead, Karan.
Thank you. Good evening, everyone. My question is regarding takeaway food. Now, the general consensus is that we should not touch our eyes and nose and mouth. But on the other hand, they say that takeaway food is fine. Or maybe suppose the takeaway food has maybe a trace amount of viable virus. So is that going to be a problem if someone ingests that kind of food?
Dr. Chatterjee, a lot of people often have no choice right now because of the lockdown. Either they're, working from home or they're unable to cook. Their cooks aren't available. For whatever reason, people may be ordering food from restaurants, takeaway food. This could be a concern of worry for many.
See, what is happening is this is happening with the grocery, with the things that you get from outside, with the cartons on it. There has been a lot of studies going on. There have been a lot of recommendations which are going on that, okay, clean the vegetables with soap water and flowing water, sanitize your cartons and all these things. And whenever you get a food also, what I would think is if it is a cooked food, is obviously not a source of infection. Maybe the carton or the box in which you are getting might have been touched by somebody, and that could be the source of infection. So the recommendation as of right now is, okay, sanitize the carton or the box, but I would strongly recommend that sometimes it might become impractical in the long term. Sanitize your hands. That is what is important, that clean your hands, and whenever you're handling this, sanitize your hands well so that the rate of infection is less. How many things can you really clean in life? But yes, if you can sanitize the carton or something like that, it's not the cooked food which is the cause of the viral infection, but it is the box in which you are getting it, which might sometimes be a carrier of infection. But the most important thing is sanitize your hands, wash your hands with soap water in a running water. That should prevent infecting you.
All right. Ram Singh from Puducherry, Ram Mohan Singh from Puducherry calling us. Go ahead, Mr. Singh.
Yeah, good evening, doctor. I just wanted to know, once the droplet touches our skin, is it possible that it goes only through the openings in our body, or even it will perforate through the skin itself? This is one part. And next part is, when we take bath, we tend to put soap in our ear and clean. So then it is not possible for us to clean the ear completely like we clean our face, mouth, eyes and all that. So is there a possibility that it will go inside through our ear or through our skin, or it will go inside and infect our body only through our mouth and eyes and nose, etc.?
Yeah. So the answer is that there is no possibility of transmission through an intact skin. But certainly, if you have a big cut or a wound and you have something falling directly on the wound, well, theoretically, it can enter from there. So if you have a wound or something, a big wound or a big cut in your hand, you must keep it nicely dressed and covered. Otherwise, through the intact skin, there is no transmission. Same way, when you take bath, I don't think you put soap inside the ear. You put soap outside, and if you put soap, all the parts of the body, if there is any virus anywhere, this virus has a fat layer around it. So when you use soap, that fat layer gets broken and the virus dies immediately. So using soap water is the best, cheapest, most effective way to kill the virus.
Okay, doctors, I want to just go across to a new update in this story, and I know many mothers have been watching this or reading about this and feeling better about the situation right now. This is that American study, I'm sure you've heard about this, which analyzed data from 178 countries, and they claim that countries that have a universal BCG vaccination policy or a program like India does sees a lower death rate due to COVID-19 than those who don't. Now, doctors and scientists in India seem to be divided on this. Where do you stand? Dr. Kumar, and first you.
Yeah, so there are 2-3 things which are actually very hotly being discussed. One is about the BCG, and that too, BCG being given right in the beginning of your age, as is the practice in India since 1949. Now that increase improves our immunity, and that definitely is now being very, very clearly linked to lower incidence of infection as well as probably a lower mortality in this group. However, I must say that at this point of time, this is still an area where the researchers and doctors are intensely debating. The hints are definitely in favor of a positive role of BCG vaccination to the extent that Australian government has started a trial where 4,000 healthcare workers or rather patients are being recruited. So 4,000 healthcare workers, half will be given BCG vaccine, half will not be given, and they will be following whether the ones which receive BCG have a lower chance of acquiring this infection and complication. So BCG definitely emerging to be a positive factor. That's one. Another theory which is doing rounds is that probably the strain in India seems to be having some genetic difference from the strain in Europe, and therefore it has a slightly less infectivity. That also at this point of time is a conjecture. And third conjecture which is doing rounds is that the heat and humidity will kill this virus. There are enough suggestions in that direction. However, on these 3 issues, the final word is yet to come out. However, strong signals are there in favor of all the 3.
All right. Though we just reported that Tamil Nadu has now overtaken Maharashtra with the highest number of cases, and of course the temperatures there much higher than in the north right now. But Dr. Chatterjee, please come in on the BCG vaccine. Where do you stand on that? And in the same light, would you advise getting the flu shot? And if so, does it still make sense to get the flu shot now, even though we're in the middle of this pandemic?
I would totally agree with Dr. Arvind Kumar, whatever he said. There are strong evidence, evidence is coming right now that BCG vaccination could be of help. But obviously, it needs more evaluation. There are positive reports supporting it, and we would be very lucky as Indians. So the infection could be much lower in us if it is true. Yes, there are definite positive evidences favoring it, and I just hope that it comes out to be true. Then the incidence and the severity of the infection would be much lower. I would agree with all points which have been raised by Dr. Arvind, and I totally agree with that.
All right. Do we have Priya from Guntur? Can we get Priya? Let's listen to Priya's question. Priya from Guntur, go ahead. Ask your question, ma'am.
Okay, ma'am. Good evening. And my question to you is, the normal symptoms of COVID-19 are fever and like flu. These are common symptoms, and how can you differentiate a person who is tested positive for COVID-19 and to a normal person who is just in flu? That means who is just having these common symptoms without having COVID-19 virus. And my second tip that my home remedy that is which works a lot is that coriander water and pepper water works a lot efficiently. At the starting stage of COVID-19, why can't we use these two things to get rid of this virus, which my grandmother suggested?
All right. So Priya's first question, I think we've been asked that question many times. So Dr. Chatterjee, if you can touch upon it quickly, I want to go across to other questions. When we talk about coriander infused water, pepper infused water, is it basically just about keeping your immunity up? Because it may not end with COVID-19. You'll constantly be seeing strains like you see with dengue, for example. Is it basically just that everyone should keep their immunity up, Dr. Chatterjee?
I would agree with you, Sarah, that this is what basically might be helping the immunity. It might be acting as an immunomodulator. But as of today, we have no definite study which says that it has a role against coronavirus per se. So doing those things might just help you symptomatically, might help you build up your immunity. But to say that it is the modality of treatment for coronavirus, we cannot support it as of right now at all.
Okay. Farun from Chennai, last caller.
Good evening, doctor.
Good evening, Farun. Go ahead.
See, I had a question. This is people coming from outside India, especially from Gulf countries, landing in Kerala, are all reported, coronavirus affected. How does it happen? Probably in the aircraft which is not disinfected properly, doctor?
All right. Well, I think the question there, do we have any more callers? Basically, how do they get it? That is just such a... I mean, where could they have gotten it? Either on the plane or even just whichever country they were traveling in. Vinod from Ahmedabad, let's squeeze in your question.
Banker by profession, and for the past few days I'm having a itching sort of a feeling in my throat, and I've got a heaviness on my chest, but I'm not able to cough. I feel like coughing, but the cough is not coming. So is there something which I need to worry about?
Dr. Kumar?
Yeah. So now if you don't have fever, then it's unlikely that you have it. However, since you have this just the beginning, I would say that you quarantine yourself in the house. All your other family members should be taken precautions, and you should just be observing for the next few days. Chances are that these things will settle.
All right. Thanks so much, Dr. Kumar, Dr. Chatterjee. Unfortunately, that's all the time we have for right now. But of course, we're going to constantly keep these call-in shows going for all our viewers. Any of your questions that you have, you can put them across to the best doctors in the country right now. We'll have them all on NDTV for you. Let's go in for a short break. More news coming up after that.